Welcome back to Unraveling the Brain. I'm your host, Dr. Josh Madsen. Today we have an awesome episode. We are going to be talking with Dr. Loren about basal ganglionic dysfunctions. We'll be talking about PANS, movement disorders related to it. And so this is really for you guys out there that for doctors working with these kids to get some insight into what's going on in their, the brains and bodies of these kids, and different strategies you can do, different movement-based strategies you can do to start helping these kids to function better, to heal more efficiently. We're going to talk about all the different modalities that we use in the office as well to help these kids. Or if you're a parent that has a kid struggling with this can start giving some insight. This is by no means a diagnostic or treatment protocol for you guys, so I want to make sure you always talk with your primary care provider about different things that we talk about, so that way you make sure you're giving the best care for your own child. Let's jump into the show. Hi, welcome.
Morning.
Let's talk about the basal ganglia. Let's hammer it out. Maybe let's just start by talking about a little bit about the anatomy real quick here and just a basic understanding of how different areas of the brain interplay to that and how movement affects that. And this is kind of your area, and you know it better than most people I know, so hammer away.
I think of the basal ganglia as really like a hub for neurological function. So in some way or another, the basal ganglia is tied to basically the whole brain in one way or another. So that's limbic, largely motor, and then also our frontal lobes, attentional network, motor planning, execution of movement, motor timing. So it really manifests in a multitude of different symptoms or dysfunctions or things that bring people in, dysregulations and things like that. So there's a lot of layers to it. Anatomically, it's a hub for the brain. It's there to let the brain know what the brain is doing. The cortex, like the frontal lobe, like when you think of the brain, or everyone thinks of that picture of the wrinkly brain, like in their anatomy class, the majority of the brain is tied to that basal ganglia, and then the basal ganglia feeds back to that brain. So it's a hub, it's a relay center. It really helps organize, make things cohesive. Anatomically, there's two major components of that basal ganglia, and one's the direct pathway, and that turns things on. It turns your thalamus on. It creates more thought, more movement, more activity, more repetition. And you also have the indirect pathway, and that's inhibitory, so that's more calming. And both are incredibly important. So a lot of people know sympathetic and parasympathetic, fight or flight, rest and digest. But within the basal ganglia, we also have that direct pathway, which is more like that go, 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 and that indirect pathway, which is more calming, more regulating. And we need a good balance of both of those at all time. And they have what's called tonic output. They're always working. So when we're talking here, when we're sleeping, when we're performing activity, we need perfect function of that direct pathway, that go pathway, and that indirect pathway, that calming pathway. They both need to be functioning at a high level. Anatomically, we also have something called the hyperdirect pathway, and it's relatively new in the understanding of neuroanatomy, neurophys, neurological function, and really the purpose of that hyperdirect pathway is to have rapid control from the cortex, from the brain. And there's behavioral components, there's largely motor components, and then also what's called your associative networks, which allows you to set goals and sequence things properly and follow directions and just really be a high functioning person. So all of those parts those parts of the brain feed into the hyperdirect pathway. So we have your orbital frontal, which is largely your prefrontal cortex, behavior regulation, emotional control, calming yourself. So if someone cuts me off in traffic, I don't freak out. I don't have any unnecessary reactions. I can calm myself. That's through my prefrontal cortex, and my dorsolateral prefrontal allows me to sustain attention and maintain my focus and do the hard things even though they're not rewarding. So that's a kid sitting in class and listening to their teacher, or reading, or absorbing information, or following mom and dad's directions. Hey, go put on your shoes, brush your teeth, grab your book bag. A lot of kids have difficulties in those sequences because they're so distracted, and their brain is just consumed with excessive activity. So there's a lot of layers to this, and a lot of people will see basal ganglionic dysfunction as tics,
motor pathways. So a simple way to break that down would be is primarily the three main loops are going to be, we're going to have motor dysfunction, so we're going to see repetitive actions, motor actions. We have cognitive loops there, so we're going to see repetitive thought processes or repetitive anxiety or things along those lines. And then we have limbic loops, which those can play into emotional dysregulation, which is very commonly what you see with maybe like a PANS-PANDAS scenario where the basal ganglia gets affected, or a Tourette's or a tic disorder. So those things basically are dysfunctions, but then we have this hyperdirect pathway that comes in and can help to re-regulate or basically bypass that system through our frontal lobes, so we can start calming those things down. So let's talk about a little bit about number one, why those things can happen, maybe some of the environmental, nutritional aspects, motor-based systems that don't develop, that can play into that system getting dysregulated, number one, and then what things we can do to start helping these kids, I think, are super important. So let's start with the most common reasons for dysfunctions in these systems.
So we have that tonic output. That basal ganglia is always working, like I mentioned just a minute ago. That means it's consuming a lot of energy. So going through a lot of sugar, going through a lot of oxygen, it's requiring a lot of resources from the brain. So we see a lot of kids with just like low energy production. They might be anemic, so they're not bringing oxygen to those vital tissues. So neuron needs to take oxygen and sugar, or oxygen and ketones, and spit out energy from that. If there's a dysfunction in that delivery of oxygen, or blood sugar dysregulation where there's ups or downs, you're going to have metabolic dysfunction. So,
and to go off of that, those things can be tested with standard labs. You can test blood sugar dysregulations, glucose, A1C, insulin levels. You can test ATP production with a urinary organic acids test. So if you're suspecting this in a patient or in a kid, those are a couple of tests you can run to see if those are some underlying factors.
Yep, for sure. There's also a lot of cross-reactivity with different food sensitivities. So there's something called molecular mimicry that a lot of people are familiar with, but some might not be, where protein structures of foods that we consume look a lot like the protein structures of our own nervous system. And our antibodies are meant to identify essentially barcodes. Like they have barcode scanners, if you will, and that's a way to look at it. The barcode of some different food proteins look like the barcode of some of the basal ganglionic proteins, like the proteins of our neurons or the infrastructure of our brain. So,
and that would be anti-dopamine 2 receptor antibodies, anti-tubulin, oligoganglioside. So again, that can be tested with a test called the Neural Zoomer Plus through Vibrant Labs, or a Cunningham panel in traditional medical. There's probably some other ones that I don't know about, but.
And underlying infections or chronic infections. So again, just to follow up with that Neural Zoomer, so we can strep, Epstein-Barr, flu A even can create some cross-reactivity. So when these kids have dysregulated immune systems, they don't have really the strength to fight off these infections as acutely. So they kind of hang around. They make antibodies against these different bacterial proteins or against these viruses. And then that can also create some cross-reactivity with our own brain tissue. So that, like strep A infections of pandas, there's a lot more exposure and a lot more awareness in, just like the world of development, because it's very common. You see a lot of it. And so those strep A antibodies can also cross-react with your dopamine receptors, like Dr. Josh has said. Those and you have your D1 and D2. Those are the components of that GO and that calming pathway. And if you have strep antibodies, you're going to dysregulate one or both of those pathways big time, and that's going to manifest as symptoms essentially. So
100%.
We see a lot of these kids that have a lot of like sleep disturbances, like trouble falling asleep, or perseveration or continued thoughts that might be negative, or fears that really aren't grounded in anything that should be fearful. Just like irrational fears, if you will, or concerns with things that they might have been comfortable with a year or two ago. But metabolic, cross-reactivity with foods, latent infections or chronic infections. What else can you think of?
I've seen some different research on ochratoxin A, which is a mycotoxin, cross-reacting with those. I would say we find that pretty consistently. I always just recommend getting a total toxic burden, like looking at heavy metals, environmental toxicities, just because those have been shown just over and over again to create more inflammation. And the more inflammation we have, the more abnormal function of our immune system we have, therefore the more likelihood of having autoimmune reactivity develop. and not only just those D1, D2, antitubulin, but also many other types that are out there that can play into that. So those are some things that I always recommend looking at when we do have a lot of different markers on that neural zoomer.
Yep.
This video is sponsored by Unraveling the Brain, which is actually my course to train doctors to help these kids in the way that we do. So if you guys know anyone and know any doctors that are in your area that are maybe interested in working with kids, go ahead and send them a link to limitlessfoundation.co so that way I can help train them so you guys have a provider close to you guys. Let's jump to the show.
Well, like a simplified, I kind of talk about like a stressed basal ganglia can kind of take the brain for a ride. Since it's that hub center, you can have, thoughts that are irrational that continue, or movements that aren't productive that continue, or fears and just like attentional issues, and it just really kind of it disrupts normal constructive neurological function. So that's where the symptoms come from. That's what we're seeing a lot of.
Yep.
From just like a movement standpoint, like sensory and motor based therapies are fantastic for getting regulation, things where we're having to calm our body and slow down and focus our eyes and create some motor output. Those are very rehabbing for these motor areas, especially, and those help really develop more of those behavioral and attentional networks. Just like having good solid motor control, good understanding of our body, calming the body, and being able to create a proper output is so foundational for kids. And like kids with basal ganglia, it takes time to develop anyway. So when you think of like an infant, they twitch, they move, they're all over their place, their emotions are up and down. But as we age, after 2 or 3, those things really start to develop, and they start to get these foundational systems in line that help develop those behavioral and attentional networks within their brain. But a lot of these kids with basal ganglia dysregulation, inflammation, metabolic issues, underlying infections, autoimmunity, they have emotions that go up and down like an infant, or they might have the motor capabilities, fine motor control might be disrupted, or they might have really significant gross motor control issues, or motor learning problems where they're have trouble learning handwriting, or basal ganglia also controls all of our volitional eye movements. So a lot of like tracking issues and convergence issues, those are using those basal ganglia pathways, and saccades, like rapid eye movements, and all of those are foundational for reading and learning and being able to take in that visual input, which is really like the number one stimulus to the brain, is what we're taking in through our eyes. And just being able to ground ourselves through body control and then nice stable eyes is so foundational for even executive function and cognition down the road. So
for sure,
sensory and motor based therapies are fantastic for like really priming those systems from the bottom up. So, and that's what you've been doing for years here, and that's where a lot of results come from, just motor based therapies that develop the brain, that the brain can then take that and build on it through play, activity, like.
And a big piece of that is just simply because the basal ganglia sits in the middle of the brain, but then the main hubs that help to regulate that is going to be our cerebellum and our frontal lobes, and especially our cerebellum. Our cerebellum has like, I don't know the exact stat, but it's like 70-80% of the neurons in our brain, and it coordinates everything. It's a huge hub there, but that really develops through motor development, and that the fastigial nucleus helps regulate the limbic areas of our brain, and the dentate nucleus, or the lateral aspects of that cerebellum, which controls like fine motor and speech and things like that. It also helps coordinate our frontal lobes and our cognitive loops, and those are huge players into that. And that's probably a big reason why that as we develop, and when you look at these kids that have this stuff going on, they have really weak cores. They move abnormally. They have just really a lot of motor based dysfunctions. And when you can improve those motor-based dysfunctions, what that means is you're improving brain function, and therefore you're getting more and more regulation through every area of the brain, especially the basal ganglia. And then let's talk a little bit about, in these cases, we have found photobiomodulation or low-level light therapy to be a really beneficial therapeutic with different wavelengths, especially for these kids that have a lot of basal ganglionic inflammation from maybe an autoimmune issue or an infection or something along those lines. So maybe let's jump into that topic a little bit. So not only that, when you're if you have a kid or you're working with a kid that has this going on, you want to do a lot of motor-based stuff like primitive reflexes and vestibular rehabilitation and getting their eyes and their body to work together to help them. But then secondly would be you can add another therapeutic aspect on top of that, like photobiomodulation, and we can talk a little bit about oxygen if they have low oxygen levels. For sure.
If you look at research on photobiomodulation, it's overwhelmingly positive for really anything neurological. Like, there's like study after study, there's just like a base hit in neurological function. So you're calming inflammation, and you're driving energy production up. And, photobiomodulation has modulation in the word or in the title or in the, like that modulation can help bring overactive cells more stability through calming inflammation, and it can bring underactive cells more energy through driving mitochondrial function. So you're really meeting in the middle in both of those areas. So
in that ATP or that energy standpoint, what it's been shown to actually do is it increases the productivity of cytochrome C oxidase, which is in our electron transport chain. So that means we are actually able to, through the electron transport chain, we're able to produce more ATP, which ATP is energy for cells. So keep going there.
Well, and with that, and depending on how deep we want to go with that, cells have a charge. It's called the resting membrane potential. A healthy cell sits away from threshold, so it requires negative 70 or it's 70 to 100 microvolts for that cell to create an output, or for that cell to fire, or a neuron to fire. An unhealthy cell sits closer to that threshold, so it requires less input. So you see with these kids a lot of hypersensitivity to touch, hypersensitivity to sound, hypersensitivity to light, and because those neurons in their brain are closer to threshold, so less stimuli creates more output, which is we need that energy production, that ATP, to run pumps, ion pumps that maintain that cell membrane potential. So in inflammation, low oxygenation, infections, all of those are going to dysregulate mitochondrial function. That's really what toxic exposure, mitochondrial function. So any of those are going to slow down and dysregulate that energy production. You're not going to be able to maintain that proper charge of the cell. Cells are going to be more likely to fire spontaneously. So like study after study shows, kids with basal ganglia dysfunction or ASD have more neurological function in their brain. There's more activity, but a lot of times it's chatter. It's excessive. It's non-contributory to network activity, and networks are where we have regulation and attention and motor planning and motor control. And so getting more energy production helps to maintain that cell membrane potential, allowing better, more productive neurological function that the brain can then build on and develop. But that movement-based intervention is paired with photobiomodulation is like kind of like a twofer, if you will. Like you're addressing it from a couple of you're calming inflammation, you're driving inflammation, or you're driving energy production up, but then you're also rehabbing the brain and developing these motor-based systems that should develop from infancy to one anyway. Right. Where we see kids a lot with primitive reflexes that are retained that should have been integrated years ago or decade ago a lot of times, and just they haven't had that foundational development pieces for sure. And
it's crazy because I often just say, like, I think one of the biggest reasons that we get such fantastic changes is just simply because we're getting energy to a brain of a kid that doesn't have energy, and we're building endurance in a system that doesn't have any endurance. Like, it really blows my mind. A lot of these kids, when they come in, like, they can't even run on a treadmill for a couple minutes, and they're just exhausted, or do an activity for longer than 30 seconds or a minute because they don't have any endurance or any ATP or energy. And it really goes hand in hand with a lot of their symptoms. Is as you increase their energy production, their behavioral dysregulation starts to calm down. They're easier to work with. They can start doing more activities. So like that's why it seems like when we have kids that have ASD or have really severe neurological impairments, the first couple of days are usually pretty hard. They're but once we start building up that endurance, by the time we get to Wednesdays and Thursdays of their intensives, they really start making really significant changes. They calm down a ton. They're easier to work with. They start following directions more appropriately. But honestly, I simply think it's because they just have more energy.
Yep, for sure. Well, and you touched on it too. Getting the right labs, identifying
100%.
metabolic dysfunction, anemias, and food sensitivities, causes of inflammation, toxic exposure. All those things are going to disrupt energy production. If they have low oxygenation, we're taking pulse oxes and monitoring that throughout therapy. We're supplementing with oxygen. We're doing hyperbaric oxygen, so you're just helping give those neurons more oxygen. In the presence of oxygen, a mitochondria spits out 36 units of energy. Without enough oxygen, 2. So you're talking almost 20 times more efficient just with enough oxygen, and something so fundamental for function. A lot of these kids, just even through poor posture or breathing mechanics, like they're just limiting their ability to oxygenate tissues. Through metabolic dysfunction, through inefficiencies in their brain. When you have more activity in the brain, you're going to be consuming more resources. You're going to be going through more energy, sugar and oxygen, and so that pulls those resources out of those areas that you really need to function at a high level. So just addressing that from so many different layers and levels really allows for like the optimal results. It's not just one therapy. It's not just laser. It's not just one lab. It's not just one supplement. It's always multifactorial.
Right.
And that's really where the results come from.
Yeah.
It's not an easy fix, but it's a process, and it's, think of it kind of like a marathon in one way, but it's something worth running for sure.
Yep. I just tell parents or other doctors, it's like the more things you can figure out, like no matter what a kid comes in with, it's never one thing. Nope. The more different things you can test and figure out, and running all these labs you talked about, running their genetic variations, running just all these different things to get a full picture of what's going on, and then trying to address as many of them as you can. Because in some kids, maybe we can't change their diet. Maybe it's way too restrictive, but maybe we can add in some different supplementation over here, or start adding some different foods that are that have the nutrients needed that they're missing, or so we can start addressing. And the more different things we start to address, the healthier and healthier the child gets, the healthier and healthier their brain gets, and the better they do, and the better their movement develops and their motor systems develop. So, which really starts to make the change. Which is a really fun topic. Any closing thoughts on basal ganglia? I hope this really helped a lot of doctors out there to understand what's a little bit more about what's going on with these kids. So when you have one come in, you know what you can start addressing and looking at with them. Yeah,
I mean, like you touched on it there, healthy brain. Healthy brain even means a more optimal digestive system, better breathing,
better absorption of nutrients.
Yeah, better autonomic function. So, kids with these chronic food sensitivities or gut dysregulation, you see a lot of chronic constipation with underdevelopment of the brain, or chronic diarrhea, or
chronic yeast infection, bacterial infections.
Yeah. Things are just getting backed up and not moving through their digestive system fast enough because they don't have the right tone. They don't have the right neurological control of those vital organs. So as the brain matures and as you're able to get more development there, you can see a lot of improvement in even autonomic function.
Yeah.
Pooping. Just like more regularity, better bladder control, bowel control. And those aren't things we address directly, but those are byproducts of a maturing brain. If you're able to help provide that, eliminate those stressors to the brain and then build on top of it, then that allows that brain to then mature further. So
100%, especially around primitive reflex work, and those are highly associated with just normal brainstem function and development of that and control of the brainstem, which a lot of those systems come out of, like our vagal system comes out of there, which controls our digestion and those types of things. But 100%, the more developed they get, just the better. So
what could people look for what kind of symptoms, or what would be something that people could address, and if they're a provider or they're a parent, just to maybe like a quick picture of the health of basal ganglia, since that's the topic of this discussion. So like what would primitive reflexes for sure, eye tracking, balance, posture, behavior. What else could you touch on, or anything that they could check, or anything like big picture? Yeah,
I feel like we kind of looked at a lot of that stuff, or we talked about a lot of that stuff. But yeah, big things. If a kid is struggling, where we started in the office, where we found a lot of success is rehabbing primitive reflexes if they're there. Number one, rehabbing vestibular system, because our vestibular system has a massive input into our higher cortex. which helps us develop our frontal lobes, which helps us regulate. Same with eye tracking. Our frontal eye fields literally sit in our frontal lobes. They help to develop our frontal lobes. So the more and more better function we can get with, especially around movement and motor development, the better and better our frontal lobes get developed, the more complex they get developed. And therefore, the more complex regulation they have for the rest of the brain and body. And that's what all the research shows is I was reading a study yesterday, like kids with ASD, 89% of them fit the diagnostic criteria for developmental coordination disorder, meaning they can't coordinate their body. It's 89%. It's motor based. And so if we can improve their motor based functions, you can often improve a lot of their symptomatology and just improve their overall life and health. And so that's really the key there, is looking at those basic foundational pieces and rehabbing those. And at the same time, making sure they have enough energy and making sure that some basic labs are getting ran on these kids to see what's going on under the hood. Like let's fix some of those underlying metabolic issues so they can have energy to develop.
Sure.
Yeah. Awesome. Thanks for the conversation. It was fun.
Anytime.
I hope you guys enjoyed that episode. Like our page, subscribe to our page if you want to learn more, if you're a doctor that wants to learn more, if you want to learn about clinical stuff, business stuff, or just a parent that wants to learn. Subscribe to our page. Look forward to seeing you guys next time. Have an awesome day.